Hello and welcome to another edition of Feel This Pain. I'm Ken McKim, and tonight we're going to be talking a little bit about something known as arachnoiditis. What is that? Well, it's basically a fancy term for inflammation of the arachnoid membrane. What is the arachnoid membrane, you ask? Well, take a look at this picture and you'll find out. So basically the arachnoid membrane is a coating or membrane that protects your spinal cord nerves. And as you might expect, if that membrane becomes inflamed, because remember, if you put the suffix itis on anything, it means inflammation, not pleasant things will result. So what can bring about that inflammation? As you might expect, just about anything. You have myelographic dyes, epidural steroid injections, anesthesia, chronic disc prolapse, repeated lumbar punctures, trauma and spinal surgery, infections like meningitis, subarachnoid hemorrhages, and spinal stenosis. Lots of fun, right? And then, of course, you've got the more likely symptoms you're to encounter: tingling or numbness or weakness in the legs, the feeling of crawling insects on your skin, water trickling down your leg, well, the feeling of it, severe shooting pain, muscle cramps, spasms, bladder, bowel, and sexual problems, and like your feet are on fire. Wonderful. A further thing that you have to watch out for is repeated inflammation can sometimes cause what is called adhesive disease. Adhesive disease is basically scar tissue. We're all familiar with the way scars look on the outside of you. Well, you can have internal scar tissue too. The people who are really familiar with this are ulcerative colitis patients and Crohn's patients, because anytime you operate on somebody, anytime you cut into them, inside of them, messing around in there, you are creating more scar tissue, more adhesions, and thus down the road, more problems. So as far as treatment goes, what are we talking about? Well, as I said, surgery is not a great option for most people, so they generally try to focus on pain relief through things like opioid painkillers, non-steroidal anti-inflammatories, anticonvulsants, muscle relaxers, and of course antidepressants, because anything involving your spine usually means pain, and being in pain all the time is depressing. How about that? So if you ever meet anybody who tells you that they're suffering from arachnoiditis, now you will know what they're talking about, and you will also understand and empathize better with the pain they're going through and the horrible side effects they're dealing with on a daily basis, and maybe it'll make it easier for you to summon up some compassion for what they deal with all the time. And real quick, even on their best days, if they look like they're absolutely fine, don't ever tell them they don't look sick. It's insulting. But I cover that in another video, which you can see here on this YouTube channel as well. And that's all the time we have for tonight. Thank you so much for joining me. If you have any questions, feel free to send them to me, Ken at don'tpunishpain.com. We'll be back another time, and until next time, I'm Ken McKim. You take care.